Welcome to EchoCast and welcome Daniel Stevens. Daniel is a global training and education leader at Cook Medical, where he leads the design and delivery of training programs supporting medical device products and global commercial teams. At Cook, which he joined after a long and overly humble but very impressive 20-year career in the Navy, Daniel partners across clinical, regulatory, and sales functions to develop scalable learning strategies that ensure product competency, compliance, which you can imagine in healthcare, and confidence in high stakes healthcare environments. Specifically, Daniel has contributed to the development of global onboarding initiatives, product certification pathways, blended learning programs designed to support both internal teams and external partners. His approach emphasizes clarity, engagement, and impact, which are all nice ingredients to have when you're running training. Ensuring that training, especially again in these high stakes environments, not only informs but equips with confidence these professionals to perform with excellence. Recently, Daniel, you might his face may ring a bell here. Daniel joined us at our Echo Experience a couple months ago to share his insights on training in regulated industries, and so it's great to see him again. Welcome back, Daniel.
Hi, Jeff. Good to see you.
Great to see you, and we'll just kind of jump right in. I've mentioned briefly, and we're not going to go too deep into it, but your sort of career before the career in the Navy, very high stake. By the way, thank you obviously for your service there and all
I
the
appreciate that.
men and women that serve there. But going from the Navy, which is also a very high stakes environment, to healthcare. Okay, so it's not
hmm
like so you go from one kind of boiling pot to another boiling pot, just in terms of the impact and really the what can happen. Is that something that, from a career standpoint, is this just kind of a little bit of just how you feel like you're kind of wired and called, and or is it kind of a coincidence that you find yourself in an equally, kind of important field after your military service?
Well, I think it was a combination of factors. I was in deep sea diving, independent duty corpsman. So fancy way of saying I was a diver and a medic. So I was an independent duty corpsman. Training's a little more comparable to physician assistant. And so I had a lot of independent capacity to evaluate, treat, a lot of trauma medicine background and hyperbaric medicine, wound care, a lot of different spectrums. The one thing I knew I didn't want to do anymore is treat patients, though, because it was just, you know, 20 years, a lot of trauma, a lot of ugliness. And it was like, I am really, really tired of this. Found out that there is an entire industry of medical device, pharmaceutical, other things like that. It's like, oh, I can still actually make use of this knowledge
Yeah.
and learn how to apply it and then to use it. And then so that was 2014 when I retired. And then progressively over, I can, tell you definitely from 14 until 24, that 10-year period has been just an unbelievable increase in software and applications for better use for training. And then the pandemic was a huge turnover in terms of, okay, we need to really reevaluate travel time, money, expenses, distance for training. What can we do for outreach and still be effective and things like that? So my transition was kind of knowing I wanted to continue and use my knowledge base within clinical medicine.
Mm.
However, didn't want to directly treating patients or anything it's like that. And so
Yeah.
didn't want to keep that. And so continued on with that and started blending in with using more and more distance learning stuff. And then Jason, my boss, had already understood Inkling and knew it in previously. Incrementally started bringing it in. We convinced the higher ups this is a good path forward, and kind of that's where we went from there.
Yeah. So you've been longtime customers of Echo Inc., which we're very grateful for, and
hmm
yeah, that technology, not just Echo Inc., but just technology in and of itself, in the domain that you're in now within training and development. I mean, it's not, it's even, I think it's even silly to talk about, like, how does technology affect training? It's like training is technology. I mean, it's so
Absolutely,
deeply embedded now. So how
absolutely.
did that work for you? So not only transitioning from kind of the military, the more clinical, actually, practitioner, if you will. So you made
Hmm.
that move, okay, from
Hmm.
from from industry to industry. But then, how did technology? Was that also a shift for you? Like, was there a kind of a ramp up period for you with just technology itself, or was that something that you had already kind of brought with you into?
I'd say combination of both. I was always aware that first and foremost wanted to in terms of my just practical knowledge, I had done thousands and thousands and thousands of hours of training because that's when anybody who served in the military will tell you that, idle mind is devil's playground, and that's the absolute truth. If you have a group of young men, keep them training, keep them busy. One of my training officers, once upon a time, just before a deployment, I heard him over talking one of our warrant officers, and we were getting deployed to Dubai. Yeah, terrible deployment. But we had deployed to Dubai, and we were doing these ATFP dives, which fancy way of saying we were diving on boats looking for bombs, which was kind of a
Nah.
silly mission. But we
Oh,
were we were diving on boats looking for bombs, and my training officer said to my warrant, if you guys are working a 12-hour day, you have 12 more hours to fill in. So
wow.
his point being, idle mind is the devil's playground. It's like
Yeah.
keep training, find different ways to do it. So understanding the necessity of keep doing that, we kept finding out, you're always wanting to bring in either video based information or hands on based training or anything else like that. So,
Mm.
all the different types and methods of training and education and things like that, technology was always a part of it. And so, then if you could use it for a better complement of what's the outcome you're trying to target, bring in new technology, better videos, more hands-on training with this, better Q&A, just different ways of
Yeah.
changing changing it in different ways, and then updating as new opportunities came along, and understanding that at the core it's the outcome that the student can demonstrate. So this is what I want you to know, this is what I want you to show. How do I use technology to help me do that? Yeah, I need
Yeah.
you to increase your knowledge, I need you to increase your skills, and this is how I want you to show me doing it. So any emotional component that may be tied into that. So
Yeah.
technology is just, I've always seen it as the catalyst, the mechanism, the method to get you to the endpoint better and faster.
Yeah, that's great. Well, and the other thing is, I'm listening to you kind of connect those dots. There's the other dot that in my mind was connecting is both in the military and then also healthcare. There's a
Mhm.
certain amount of like you as a trainer, you got to make sure people are doing the right thing the same
Mhm.
way all the time, right? There's not a lot of license for like, oh, I think I'm going to try this. I'm going to dive for this bomb this way. You know what I mean? Or something like that.
Sure,
And so, and then also, and I don't mean to make light of it, but also in healthcare, obviously, I mean, there are standards that need to be applied. Yet,
sure.
at the same time, as we know in the learning industry, in the training industry, personalization is
Sure.
becoming more and more expected and needed as people are learning
Mhm.
differently and whether it's
Mhm.
physical capabilities or whatever. So how do you manage kind of the personalization kind of need that individual learners, have versus
Mhm.
like in your industry, it's like, oh no, I mean, we got to make sure everyone's meeting the same kind of level of outcome the same way. How do you balance the two?
Sure. The key thing I think is understanding different methods of presenting the information, understanding that there are people, and this is where I definitely also had a part in elevating our trainers' kind of understanding of how adults learn, the different methods that adults learn, their different individual preferences, different things like that. But key focus is always, especially with clinical medicine, it's easy. It's what's the outcome?
Mhm.
What are you trying to drive toward? It's like you have a blockage in this area of the body. Okay, we need to dilate, extract, and this is going to fix this. Okay, how now step back? How do we get to that point? Okay, you have problems in this area of the body that's bleeding where it shouldn't be. Okay, we need to get access to that point of the body. How do we stop that? Okay, what are the other mechanisms that we think about that? So it's the understanding at the end point, and then you can kind of work backwards. How do you pick out those individual points to learn how do I get to that point, and then understand that people like to hear it, see it, understand it, articulate it. There's a lot of different neural pathways that, and so I get a lot into the neurology and kind of the of learning, which is, you know, hearing, seeing, doing, reinforcing, explaining, re-articulating, articulating in different ways. So it's encapsulating all of the different adult learning methods. And then, but at the key point is, do they understand in the end? Since we're dealing with medical devices, it's very easy to say you have an instruction for use, so it's correct utilization is A, B, C, and D. And if there are parameters or questions outside of that, as far as, well, can I use it in this context? Could I use it for this? And it's like, that may be an off label use. Now, physicians are authorized to do things that it doesn't say in black and white, you can use it in this. It's like, right, but this, but I'm the physician and this makes perfect sense and this is totally applicable. It's
Yeah.
like, yes, sir, it is. And that is your judgment. And that is your judgment to
Oh,
make that. And that's what physicians have, that latitude. It's like,
yeah.
okay, this stops bleeding in this way in this area. Yes. Okay, I'm going to use it. I understand the science. I understand the chemistry. I'm not worried about that. And if
Yep.
the physician can understand that, it's like, these are our IFUs. We have tight parameters of what we can do. They also have some latitude to understand. I understand. I got it. Thank you for your instruction. I'm going to make use of it. And
Yeah.
not to say that they would use it irresponsibly, but we have parameters. And the key thing that we're always looking at the end is, do you understand what the device is trying to do? Do you understand capabilities, limitations? And then the physician's going to make their own decision about, yep, I understand it and I know what it can do, can't do, and I'm willing to take this risk for what it is. So,
Yeah. Well, and you talked earlier about and you said something that just again resonated because we use it a lot. We use this language a lot at Echo around show what you
yeah,
know. And so there's knowledge that you were just speaking of, like, okay, do you know what this does? And you can get that through you know, kind of a traditional kind of assessment,
hmm,
and then get data on it. But then there are some things, and again, I would imagine in healthcare, like you literally, like, you need to be able to, you as a trainer need to be have the confidence that these learners can actually do what they're
sure.
now learning. So how do you get at that as a trainer?
Practical assessments. A lot of the
Okay.
times, we'll set up very relatively simple scenarios of a a demonstrating show and tell, and that's usually give them a very clear parameters of expectations for, you know, knowledge of. I use a lot of acronyms and things like the FFBAD: features, functions, benefits, application, differentiators. So, what can it do? How does it apply? What can't it do? What makes it different than other devices? And so, there's a lot of different ways of kind of framing the information, but it's setting up a parameter and situations where you are speaking to either nurses, physicians, or technicians, so scrub techs, who are the people usually who you're handling your sterile instruments inside the operating room. If you had to articulate to them, okay, this is the device, this is its application, these are the steps in using it, here's how you remove it from the sterile package, here's the pass off to the sterile area. When you take it out, you remove this. And so, can you go individually through the steps and articulate what the how to apply it in a sterile space?
Yeah.
And so that's where it gets just a little bit different, is understanding that it's like, ooh, okay, I can't just rip it off and hand it over. This is a sterile environment. If you've ever been in a sterile environment, an operating room, areas you don't step over, very specific parameters and protocols that you're going through. So we create scenarios where they can articulate themselves. What do you know? What can you show me? And now, can I ask questions in between and get you off task? Can you get
Mm.
yourself back on task? I
Cool.
want to challenge you. I want to create some artificial stress just a little bit,
Yeah.
because this is going to happen. This is going to happen. You're going to have somebody who just came in late. You're going to have two nurses in the back who are talking amongst themselves and they say, "Hey, wait a minute. We used this before. That didn't work that way."
Mhm.
Something is going to happen that is going to create a little bit of artificial stress in that scenario. And we then challenge you, get back on task to where you were.
Yeah.
And so we'll create grading rubrics that give a little bit of latitude in terms of, you can do outstanding, which no questions, no problems. You can make some minor mistakes, which is going to happen in reality. Or the third parameter is, yeah, okay, you're falling short in this area and we need to work on that.
Yeah.
So,
That's cool. How back to technology then, because you're describing that, you know, I'm thinking of how, you know, how you could be using things like video to you know
mhm.
have people record or whatever. How much do you depend on? the technology itself, so the tool itself, to
Hmm.
come out of the box with everything, you need to be able to measure and the data, all that kind of stuff, versus like what you just described. Like you've obviously thought of like, okay, how this is how I'm going to do this. This is how I'm going to
Hmm.
stage this, whatever. And now I'm going to go find a technology that can accommodate what I've designed. Like, does the technology ever lead the kind of assessment just by nature of what it does, or for
Hmm.
you is the technology always something that you're looking for to accomplish the goal that you've already set out?
I'd say the technology would be a complement to whatever we're doing, and it's a little bit of a tricky question in the sense because I also have to think of it that Cook's a global company.
Yeah.
So that right there infers a lot of challenges: location, difference in time zone, difference in local languages, and those are
Yeah.
major challenges. You have completely different regional needs, and then also different devices are going to be actually available in the EU versus Asia Pacific, and
Mhm.
sometimes the EU doesn't want certain devices that Asia Pacific does. And so those are kind of the challenges that we're looking at in terms of, okay, can the technology help us communicate, articulate, and disseminate? Those are a really key focus areas that we have to think about for that. And so those were the key things that I think we thought of first. And that's what, when Jason brought Inkling on board with us, it was like, okay, yeah, this solves so many of our problems, which was, how do we create a QA'd version of our information and then disseminate it? Because as soon as you disseminate it, it's open to anybody. It's open to
Yeah.
anybody. It can be modified, it can be printed, it can be sent off, and things like that. It was a constant problem that we had that Inkling instantaneously solved. And it was
Mm.
like that. This is one of our biggest problems, and it's also we had a really crappy QA process. Pardon my French, but it's just it was terrible. It was just point blank. It was terrible because we didn't have the key component, which was a confined method of building the material, QAing it, and then disseminating it in a way that it wouldn't constantly get altered or changed or anybody
Right.
else like that. So there was no
Right.
containment on it. So
Yeah.
Inkling solved all of those problems, and it gave us the ability to communicate better with Zoom, Teams, anything else like that. For
Wow.
distance communication, it just simplified so many of the problems that we were having, that we're still trying to convince the other half of the company that, yeah, it's going to be about 2 years worth of pain for them to get through all of their process and all their materials and stuff like that. But we've since we've done this for several years, and we've created the reality of, we've created the QA process, we've created Inkling in this, and we have an entire system that makes it much more useful and much more practical in terms of its application. So, I guess, to back to your question, it Inkling gave us the solutions to problems that we couldn't build a system to have a consistent method of disseminating on a global basis, because we were missing that key core element of the software in the center, which
Yeah.
was, how do I build it? How do I QA it? How do I disseminate it in a
Yeah.
in a contained manner? And that was it. That was the
Yeah.
key solution.
Yeah, no, that's a great example. It's a great use case.
Yeah.
Said we're very honored to be able to support it, and thank you so much for sharing a little bit of how Cook Medical is utilizing the ecosystem and all the great work that you're doing. So we're gonna let Daniel go now, but everybody else, stick around for a quick demonstration now of some of the applications that Daniel is actually referencing here in this EchoCast. And then you can go to echo360.com for more episodes like this and more resources to transform your own learning.
Thank you to Daniel Stevens for sharing how Cook Medical is transforming global training to support both commercial teams and clinical professionals in high stakes healthcare environments. At Cook Medical, training is designed to not only build knowledge, but to ensure that learners can demonstrate understanding and apply it correctly in real world scenarios. One of the biggest challenges Cook Medical faced was managing training at a global scale, across regions, languages, and product variations, while maintaining strict quality and compliance standards. Training content needs to be created, reviewed, and distributed in a controlled way, ensuring that every learner receives accurate, up-to-date information. To demonstrate how Echo360's Echo Inc. supports this mission, let's start with Echo Pathways. This experience provides a structured learning journey, guiding learners through onboarding, product training, and certification pathways, whether supporting internal teams or external partners. Echo Pathways ensures that learners clearly understand what to complete and can track their progress every step of the way. I'll be showing how a learner selects a training module and progresses through an Echo Inc. experience. You'll see how content is delivered in a consistent format, how engagement is captured, and how completion is tracked across a global workforce. Once inside a pathway, learners launch steps that deliver standardized, high-quality training content. Echo Inc. allows Cook Medical to build, quality check, and distribute training materials in a controlled environment, ensuring that content remains consistent, accurate, and compliant across their global organization. These pathways combine structured content, visuals, and knowledge checks to reinforce key concepts, helping learners not only understand the material, but confidently apply it in real-world situations. By utilizing Echo Inc. and Echo Pathways, Cook Medical is experiencing the benefits of transformational learning with the ecosystem, and exemplifying Echo360's purpose that learning changes for the good.